students, welcome to another question practice session. So here is the first question. First question is, oral iron supplement are prescribed for child with iron deficiency anemia. The nurse instructs the mother to administer iron with which food? Okay, so what is the meaning of this question? A patient, a child with iron deficiency anemia, and the nurse is instructing the mother to replace iron along with which food? For a better absorption of iron, you have to replace vitamin C because vitamin C increases the absorption of iron, or vitamin C is helping to increase the absorption of iron, or vitamin C is helping to synthesize iron, proper synthesis of iron. Clear? So, this point is okay. So, if you are preparing for any of nursing exam, you have to know how do we select the correct answer from options. Usually for all nursing licensing exam, you will get one question and there will be 4 multiple choice options. Okay. From these 4 options, you have to select one correct answer. So, how do we select the answer? For selecting good, appropriate answer, you have to remove the wrong answer first. Okay. For removing wrong answer, you have to be very clear that what is the meaning of the question and what is the content of the question, what is the context of the question, okay, and what is the key word of questions. Okay, a question keywords, adinte content, content base cheyiditana question. For example, suppose it could be a disease condition, it could be related with a diet, and it could be related with a nursing assessment, nursing process, and various. So, even diet related iron deficiency anemia or patient iron replace either food it is vitamin C. So, please select vitamin C content food. So, in this you can remove water, even milk is calcium rich diet, apple juice is potassium rich, and yes, orange juice is the correct answer. So, the correct answer for this question is orange juice, that is vitamin C rich diet. Fine. Next question. The client is placed on neutropenia precautions. Which information should the nurse teach the client? Okay. So, what is the meaning of the question? Oru client neutropenic precaution. What is neutropenia? Neutropenia is neutrophils count korvaayikkum. Number of neutrophils will be reduced and it causes or it increases the chances of infection. So, infection chance koodunna oru situation aanu neutropenia. So, infection varadirikkanulla precautions. Okay, fine. So, angane oru patient neutropenic precaution place cheyidittulla patient aanu. Which information should the nurse teach the client? So, to prevent infection or as a neutropenic precautions, what information does the nurse teach the patient? Number 1, shave with electric razor and use a soft toothbrush. Usually, option A is normally recommended for a patient who has bleeding tendency. Okay, so first option is considered as bleeding precautions. Number 2, eat plenty of fruits and vegetables. Eating fruits and vegetables are considered as a raw food. If patient has tendency to get infection, you are not supposed to give fresh fruits and vegetables. That means always you need to provide cooked meal. Okay, raw food normally we will not provide. Fine. So you can remove B. And C, perform perennial care after every bowel movement, which is considered as a cleaning method, where after bowel movement, while cleaning, you have to follow a thorough cleaning method. Even yes, obviously that will help to prevent further infection. Yes. And some blood in the urine is not unusual. That statement, some blood in the urine is not unusual, that is something related with bleeding precaution. Okay. So D is related with the bleeding precaution, A is related with the bleeding precaution, and B and C is considered as neutropenic precaution. But you have to avoid eating plenty of fruits and vegetables. So second statement is something wrong. Okay. So the correct answer for this question is option C. Perform perennial care after every bowel movement. മനസ്സിലായോ? So ഒരു correct answer select ചെയ്യാനായിട്ട് നമ്മൾ എന്തൊക്കെയാണ് ശ്രദ്ധിക്കേണ്ടത്? ഒന്ന് ഈ ക്വസ്റ്റ്യന്റെ keyword മനസ്സിലാക്കണം. And second is what is the context of this question? അതായത് ഈ ക്വസ്റ്റ്യൻ എന്തിനെ ബേസ് ചെയ്തിട്ടാണ്? സോ ഇവിടെ ബേസ് എന്തിനെയാണ് ഇവിടെ ബേസ് ചെയ്തിരിക്കുന്നത്? ന്യൂട്രോപീനിക് പ്രിക്കോഷൻസ്. ഓക്കെ. സോ അതാണ് അവിടുത്തെ കോൺടെസ്റ്റ് എന്ന് പറയുന്നത്. ന്യൂട്രോപീനിക് പ്രിക്കോഷൻസ് ഒരു നഴ്സ് എങ്ങനെ പേഷ്യൻസിന് ഇൻഫർമേഷൻസ് കൊടുക്കും, or what are the precautions that will be usually recommended for each of the patient who has tendency to develop neutropenia. Clear? Okay, next question. 24-year-old female client is diagnosed with idiopathic thrombocytopenic purpura. Which question would be important for the nurse to ask during the admission interview? So what is the question here? 24-year-old female client who is diagnosed with idiopathic thrombocytopenic purpura. What is this condition? Idiopathic thrombocytopenic purpura. So it is simple. Thrombocytopenia, that means low number of platelet which causes purpura or bleeding. Fine. Which question would be important for the nurse to ask during the admission interview? So patient is admitted, and while taking history from the patient, what question you would ask the patient, which should be something related with thrombocytopenic purpura. Fine. അതായത് idiopathic thrombocytopenic purpura ഉള്ള ഒരു പേഷ്യന്റിന്റെ ഹിസ്റ്ററി കളക്ട് ചെയ്യുമ്പോൾ ഏത് ക്വസ്റ്റ്യൻ ആണ് ഒരു നഴ്സ് പേഷ്യന്റിന്റെ അടുത്ത് ചോദിക്കുന്നത്? That should be, it should have some like relation with this disease. Okay, we'll read the options. First option, do you become short of breath during activity? Activity ചെയ്യുമ്പോൾ breathing difficulty develop ചെയ്യുന്നുണ്ടോ? That is something related question to identify either anemia or respiratory problems. Second option, how heavy are your menstrual period? Menstrual period എന്തുമാത്രം heavy ആണ്? That means that is something related with bleeding. Yes. Third option, do you have history of deep vein thrombosis? And D, how often do you have migraine headache? So migraine headache and thrombocytopenic purpura is not related. If it could be simple headache, yes, you can relate. Otherwise, this is not related with. And thrombocytopenic purpura, do you have history of deep vein thrombosis? Is again not directly related. So the correct answer is, you have to just ask the client related with the bleeding. So the situations which is something related with bleeding is second option. How heavy are your menstrual period is. Okay. So the correct answer for this question is second. How heavy are your menstrual period? Okay.